All right, and welcome, guys. Congrats on signing up for your initial evaluation or opting into our forms to get a little bit more information about us as a clinic. Just to reintroduce myself, I'm Dr. David Thomas, and I'm one of the physical therapists here at Cadence Physical Therapy. Really appreciate you guys taking the time to open up the second video here. And so what I'm going to do is I'm going to dive into the 4 phases of recovery, what sets us up to be a little bit different from your traditional physical therapy clinic, like ATI and Athletico, not to bash anybody. I used to work at one of those companies. I won't tell you which one. So to start off, I've got a few questions for you guys. So who here wants to learn the process to getting better faster? And secondly, how many of you guys want to learn on the process to preventing your pain or dysfunction from ever coming back? Just a little bit of a backstory about me before we dive into the 4 phases of recovery. I myself have suffered from low back pain and sciatica on 3 different occasions in my lifetime, all 3 instances occurring before I became a physical therapist in 2019. So deadlifting injury, if any of you are familiar with the Romanian deadlift, essentially it's lifting a heavy object, in my case a barbell, from the floor up to your waist into a standing position. Each time I had been doing it, realizing looking back with improper form, I wasn't stretching, I wasn't engaging the right muscles, and I was compensating with just momentum and hinging off my ligaments on the spine. And because ligaments aren't designed to take on all the weights as your muscles should be, I ended up bulging a disc, the same one, L4, L5, 3 different times. And physical therapy was a huge process to me getting back to where I am at now. But knock on wood, after the 3rd time, my problem never came back, and I hope it never does, because I did something a little bit differently this time, which will carry into our 4 stages of recovery. I essentially, the 3rd time I injured myself, I made sure I made it all the way to stage 4 and pretty much continue to do that to this day. So thank you guys for allowing me to share my story with you guys. Hopefully that gave you a little bit of background to know that I myself have been through debilitating pain that sent me to the ER before. So I can definitely empathize with you guys in dealing with pain and how it's impacting your life function, can't go back to what you got to do, etc. So I want to share with you guys. So one of the things that I find that makes Cadence therapy a little bit different from most other clinics. And so what I have in front of you is our 4 phases of recovery here. So if you guys recall in the previous episode, many and even most musculoskeletal issues can take a pretty long time to heal, several weeks, months, and even as long as a year, depending if there's a complete break of a tendon, a breaking of a bone. These issues can take quite a long time, but what we want to do here is we want to expedite that process, right? So I was finding that most of our patients, I would say they get 40% better within about 6 to 7 visits, which is to me pretty awesome, considering it can take weeks and months for most issues to improve. So typically from the results that we've seen statistically in our clinic since we opened is about 40% improvements occur between that 6th, 7th, and even 8th visit. The only issue is a lot of people tend to focus on just this inflammatory and pain phase, and these issues don't go away if you just drop off at that stage. So what I was finding is that many patients tend to drop off at around visit, 6, 7, 8, 9, sometimes around 10, because patients say, oh, my pain's a lot better. I can tolerate it now. I think I can figure this out on my own. And I said, you know what? Okay. I think you're good to go too. And if you need anything, you know where I'm at. And, they would want to discharge early. And I'm not trying to push people to stay longer if they really don't want to be here. And then lo and behold, these same patients, I was finding they would come back within 1 month, 2 months, 3 months. I say, hey, how are things going? And they, tell me not good, the pain's back. And, we were finding that a lot of these people that just get through this inflammatory and pain stage of rehab, they never made it through the other 3 stages. And I myself did not make it past the first stage, the first 2 times I injured myself. So what happens that leads to re-injury, return of pain, and dysfunction ultimately. So what I want to talk to you guys about is what we aim to do for the majority of people that come to the clinic. You're coming in either because you have pain or you have dysfunction, one of the two, sometimes both. Mostly they're correlated, but you either have pain or dysfunction. So we want to get you out of that inflammatory and painful phase as early on as possible and as quickly as possible, right? So you can get back to tolerating things, driving, cooking, cleaning, working, etc., back to the gym. And that usually occurs within the first 6 to 8 visits of physical therapy. However, once we get past that inflammation and pain phase and the pain's more tolerable, the swelling's a little bit less, the next goal we want to focus on is taking us to stage 2. And so in stage 2, what happens is we start to focus a little bit more on getting that mobility and flexibility back to within normal or at least functional limits. At the same time, we also want to focus on strength as well. So the strengthening, mobility, and flexibility phase pretty much comprises the phase 2 of rehab. And we go through that for about another week, another several visits, and we continue to do things at home to work on that pain modulation, continue to do the strengthening exercises, mobility and flexibility. So we will always continue to work on pain, but we started to really transition into more of that functional return, right? You can't get back to running or squatting or deadlifting if you don't have the right mobility or flexibility, let alone strength to get there, right? Because being pain-free doesn't make you strong. Being pain-free doesn't make you flexible. Being pain-free doesn't mean you're functional. So once we start incorporating these 3 things with the pain, strength, mobility, flexibility, around the 11th to 12th visit, we'll move into what's called stage 3. And then stage 3 is when we really try to transition everything that we were working on in phase 1 and 2, especially phase 2. We try to use those strength gains, mobility, and flexibility gains to start to replicate tasks that are within your normal activity levels, right? Whether that's you just want to go on a walk with your grandkids again, you want to get back to, Pilates or powerlifting activities, whatever your goal may be, we tailor towards that return to function, right? So phase 3 is incorporating everything that we've been working on for the previous 10 to 12 visits and then retransition that into getting back to doing your normal activities, whatever that may be. And then right around that 14th, 15th, 16th visit within this window, we finally get to that stage 4, which is the maintenance of strength, truthfully maintenance of everything that we've done thus far, not just strength, but maintenance of strength is a good comprising word. And then, of course, prevention of injury. This tends to be the most neglected part of physical therapy. Just because you can do a couple deadlifts or you can go up a flight of stairs now with tolerable to no pain, doesn't mean we've really hit the prevention stage, right? So what does that comprise? So prevention of injury is continued progressions of the normal activity levels, making the exercise a little bit more harder even than they would be in your typical activity. That way, if you're able to do things in a more challenged position, more challenging way, you're significantly less likely to wind up back at this first stage if we make sure we do a good job and take care of everything in terms of prevention of injury. So just wanted to walk you guys through that. So as long as you make it through the first, second, third, and fourth stage, the odds of you having a successful rehab and not having to come back to physical therapy, not having to go back to your doctor to get a corticosteroid injection or get back on opioid medications, is if we make it to that stage 4, I can tell you firsthand, the vast majority of my patients, I don't see them again unless it's for a different issue that we haven't worked on if we make it to stage 4. So I encourage you guys, obviously we want to get that pain down as soon as possible. But if we make it to stage 2 and then to stage 3 and to stage 4, your likelihood of having a long-term recovery is significantly higher. And that's what we strive to do here at Cadence. We're not here to just make you pain-free. We're here for you to regain your life back and never have this issue again and just learn how to use your body properly and how to heal yourself with your body. So thank you guys again. Thanks for tuning in. And I look forward to talking to you guys in the next upcoming video. Take care. Bye-bye.